So I want Skye, for you, if you don't mind, to you've been doing testing now for some time. You're very successful on that. You recently got your California board certification. What this has done for your practice, and how do you use it in your practice?
Let's see. Practice. So I've been doing diagnostic testing for about 4 or 5 years now. To be honest, in the beginning, I was overwhelmed because I had just bought the practice for my partners, just to give some backstory. And you know, that process, if you have a private practice. And until this last year or two, really being committed to integrating diagnostics into the clinical practice has probably been one of the single most influential changes on the trajectory of the practice. We all went through the last few years where hiring was probably the most difficult thing you probably went through as a practice. And so these are tangibles that Dimi didn't even mention. I mean, as far as recruiting, and you're looking for that bench of A players. You don't want just a therapist. You want a therapist. You want someone who cares and who's going to help define the future, not just for themselves, but for your clinic, right? And so for us, that was probably one of the first tangibles, is now being able to find those differentiated therapists, to the point now where we're going to be taking one therapist per year through the diagnostic training. That's just part of our clinical model now. It's just, we're not, hopefully more, right? So as we start to understand the public as it relates to diagnostic testing, going out to external referral sources and that kind of stuff, not just doing it all in-house, like Dimi was sharing, with just the changes in your practice pattern that you can have just with the knowledge you gain to treat patients better, right? So now you're all of a sudden an expert, right? But now starting to develop that reputation with the outside world. For us, it's been huge. It's a significant part of, like I said, recruiting. So every new therapist that comes gets an introduction to diagnostics, even if they're not a diagnostician. Why? Because they need to understand, as Dimi kind of quickly went through the tensioners, relaxers, and gliders, right? Like that's common knowledge, but it can be a little overwhelming for a new grad and all that stuff. When do I do this? And you look at that big data set. And, I mean, it's overwhelming, you know, if you don't know what you're looking at. But once you understand it, it's actually a quite powerful tool. And then if they struggle with that, ultrasound slam dunk, right? Because they just understand the anatomy. And I think that's probably been one of the most tangibles for patients. You're in an evaluation. The failed PT example that Dimi gave us, if you haven't seen that yet, it's pretty common. I'm in California. That's pretty common practice now, not just for shoulders, but for a lot of different things. And it's really nice to be able to say, even if the patient's insurance won't cover it, or you don't want to go through a cost, hey, $150, let's do this ultrasound right now. I'll have your answer in a few minutes. And the peace of mind alone is worth it, right? So positive test or a negative test changes trajectory of that treatment significantly for both the clinician and the patient. You know, and that's probably been one of the, you know, I even get goosebumps thinking about it, just thinking about the EMGs I went through this week. And one of the guys had a negative, you know, just calm. Okay, let's treat the symptoms now. We don't have to worry about this more serious radiculopathy that we were concerned about because you had a 2018 discectomy. You know, he was all worried about his discectomy coming back and in a problem at that level. So really fun to just kind of see those smiles. Those are the things that are on your stat list, you know? And so anything else I could expand on?
That's awesome. And I mean, we can have a dialogue.
I could go a long time, but
and